High-dose niacin has long held a strange position in medical nutrition, celebrated for its ability to lower LDL cholesterol and raise HDL, yet increasingly scrutinized for its potential to worsen the very metabolic conditions it's supposed to help. And nowhere is this paradox more striking than in the relationship between niacin and diabetes risk. While niacin, vitamin B3, is essential for life, playing a critical role in energy production via its conversion to NAD, when taken in high doses, particularly in supplement form, it begins to behave less like a friendly vitamin and more like a disruptive guest at the metabolic dinner table. Several large studies and clinical trials now suggest that high niacin intake, especially in people with metabolic syndrome or prediabetes, can worsen insulin resistance and may even increase the risk of developing type 2 diabetes. The first clues came from cardiovascular trials where niacin was used pharmacologically, often 1,000 to 2,000 mg/day, to improve lipid profiles. While patients often saw reductions in triglycerides and increases in HDL, follow-up data revealed an unexpected uptick in new-onset diabetes. The HBS2 Thrive trial, for example, which included over 25,000 patients, found that niacin use led to a statistically significant increase in diabetes diagnoses. The AIM High trial echoed this, showing worsened glucose control in patients already dealing with insulin resistance. Mechanistically, the picture is starting to come into focus. High-dose niacin appears to impair insulin sensitivity in muscle and adipose tissue, at least partly by interfering with free fatty acid (FFA) metabolism. Niacin inhibits lipolysis, reducing FFA levels in the short term, but paradoxically, this suppression may lead to a rebound increase in FFAs and disrupt insulin signaling pathways. There's also evidence that niacin downregulates adiponectin, a hormone that enhances insulin sensitivity and glucose uptake in tissues. Lower adiponectin equals higher insulin resistance. It doesn't stop there. Niacin may also contribute to oxidative stress and inflammation, particularly when metabolized in excess. Metabolic byproducts like N-methyl, 2-pyridone 5-carboxamide 2-py and N-methyl for pyridone 3-carboxamide for py can accumulate with high-dose niacin intake, especially in individuals with kidney issues or existing metabolic strain. These metabolites have been associated with vascular inflammation, renal stress, and in some models, glucose intolerance. What's particularly concerning is that individuals with metabolic syndrome, those already struggling with insulin resistance, high blood pressure, abdominal obesity, and abnormal lipid profiles, are often the very same people who might be prescribed niacin for cardiovascular protection. Yet they may be uniquely vulnerable to niacin's glucose-worsening effects. The compound's ability to raise HDL might not compensate for its tendency to nudge blood sugar and insulin resistance in the wrong direction. It's also worth noting that this risk doesn't seem to stem from food-based niacin. Dietary intake from whole foods, like poultry, fish, seeds, and whole grains, has not been associated with increased diabetes risk. In fact, these foods often contain other nutrients like magnesium, fiber, and antioxidants that improve insulin sensitivity. The problem lies with pharmacological niacin or overfortified foods, which can provide 10 to 50 times the RDA in a single serving and bypass natural regulatory pathways. So, where does this leave us? For the general population, moderate niacin intake from whole foods remains safe and necessary. For people with metabolic syndrome or prediabetes, caution is warranted, especially when considering high-dose supplements or fortified foods with cumulative B3 content. If niacin is being used therapeutically, it should be closely monitored with regular glucose and HbA1c testing, and ideally under the care of a clinician aware of this risk-benefit trade-off. And for those seeking cardiovascular benefits without the glucose penalty, alternatives may offer a gentler path, like omega-3 fatty acids, fiber-rich diets, polyphenol intake, and targeted exercise programs, all of which improve lipid profiles and insulin sensitivity. In short, niacin isn't evil, but like many things in nutrition, the dose and the context makes all the difference. When used recklessly, it can quietly shift your metabolism in the wrong direction, especially if your glucose regulation is already under strain.